No, but Dr. Matheson is an American board certified surgeon of obstetrics and gynecology. He's an assistant professor in the Department of Gynecology at NYU, Langone. Langone, how you pronounce that, Doc?
Yeah, Langone. Yeah,
Langone School. He's board member, New York State Education Department. He's of course Christian Cultural Center for a gazillion years, and he's a husband, father of three, grandfather of three. Most importantly, he's a man of God. He has a heart for the family of God and heart for people, keeping people healthy with information, with proactiveness. In terms of maintaining their health. He's always a featured speaker for us whenever we need commentary on health related items. But overall, he's a good man of God, and I'm just honored to call him friend. And I just bring him to you now without any further ado. My brothers, give your greetings to Dr. Donald Matheson.
thank you. Thank you, sir. Thank you. Thank you.
Amen.
Thank you so much. Like you said, this is something that actually came to me. Like you said, we used to do the health fairs, which was, like you said, was a big thing back in the day, and we kind of drifted away from that. And now with all this pandemic, we definitely not doing anything. One of the things we were trying to do, and Pastor had asked me to try and put together what we call a medical minute. And we actually pre-recorded a whole bunch of stuff for the church. But it never came. I think a couple of them came off, but then January 2020, everything just crashed. And I think this is, Brother Rod, as you're saying, this is something it is an introduction. And I just want to bring out some topics. I can't hit all, we can't go delve into each topic, and I hope that this is an introduction. I am willing to come back. I'm willing to talk on individual things, but I also—
We accept.
I will. One of the things that you mentioned is, heart health. And I just want to just briefly, these are things that you already know, and I'm going to talk about, and some newer concepts that will affect you right now, not necessarily with heart health, but for your health in general. And, if you could help me or guide me, I want to share a screen with you.
Don, can you make Dr. Matheson co-host?
Yes, if I can share a screen. Oh, you have to do that first, or oh boy.
Is it a video or is it a—
No, it's just a PowerPoint presentation.
All right, then what you want to do is okay, is that it?
Yeah.
All right, we see it.
You see it? Okay.
Yep.
You see it now?
Yes, sir.
Yes.
Okay. So at first it was going to be kind of hypertension, healthcare, stuff like that. And then I said, after talking to Irsa, I said, let me introduce some topics that we can probably later go on and get more in depth. So that's why I just changed it to medical update. The first that we started out was saying, let's talk about heart health. And first of all, right, in spite of all the things that's been going on, right, heart disease is still #1 killer for us. So what we need to understand what this is all about. And basically, we're going to start with, and I will tell you my personal history in addition to this. I have high blood pressure. I have elevated cholesterol. And how do I manage that? So normal blood pressure, we've heard this before, 120/80. Mark this it says less than 120/80. Before they changed this whole criteria. Now we have different levels. So what you should take away from this is that whether you have it or not, I mean, I think it's good to have a blood pressure cuff in your house. Just take your blood pressure, and we can share this information or whatever, but it's pretty straightforward. If it's greater than 120/80, there's something that you need to do, and you don't want to end up in the bottom rung. That's what I deal with in the hospital when we're in this crisis, you know. And if we stay in the green area, if we do the changes that we need to do when we're in the green area, or even in the yellow area, when we can prevent heart attacks and all that stuff. So I just want to run through some basics with you. This is just, you don't have to memorize this. One of the things that I talked about, even with the medical minute thing, is that there are things that we can change. A lot of times we says, well, it's in my family, it's this, and blah, blah, blah. Yes, it is in your family. Yes, there is a genetic predisposition for us to have high blood pressure. My mom has it. My dad had it. My dad, he died at 95. So you can't control it. My mom, 97 now, she has it. She can't control it. We can control it. And one of the things, we can't change our age, we can't change the predisposition, but we can change the things on the left-hand side. So we can control that high blood pressure either with medication. We can control the high blood pressure with losing, if you just lose 5 pounds. The cholesterol, that affects your blood vessels. You block up your blood vessels, it makes your heart work harder. Tobacco use, obviously, that's a no-brainer. Diabetes, once again, that's something that we are predisposed to. The last slide on this thing, and I'm going to try and run through quickly, is racial health disparities. And that's a whole topic by themselves that I want to actually talk to you guys about. What can we do about the racial health disparities as patients? The weight we discussed, and you guys talked about physical health and stuff like that. So I just threw this in there. We don't talk about weight directly, we talk about BMIs now. So how do we calculate? You could pull this up anywhere in Google BMI. Now we don't talk about whether you're 100 pounds, 200 pounds, 300 pounds. We talk about what's your BMI, and that's based on your height and your weight. And what's normal, once you do that calculation, once you put it in, these are what's normal. I mean, obviously I am definitely not in the normal range for my BMI. And it tells us that, we need to work, this is stuff we need to work on. And what can we do to work on these things? This is what I call I use this as, this is the end organs, right? What is this high blood pressure going to do to us, right? If the high blood pressure is, depending on how high, you can pop a vessel in the brain. And that's the definition of a stroke. When a blood pressure bleeds in the brain due to high blood pressure, and then that bleeding that destroys the nervous tissue in your brain, hence the stroke and the partial or paralysis. Visual changes. It'll affect your vision directly or indirectly. If it's diabetes involved, or if it's high blood pressure, those are very tiny vessels. If you actually look at a picture, what it looks like behind your eye, those are all vessels. You pop one of those vessels, your vision is impaired. Heart failure, just I actually thought about this, reflected just looking at this slide, right? God gave us a heart that doesn't fatigue. It's a muscle that never, that heart was beating before you were born, and it never stops. If it stops, we have a problem. And in the normal situation, it will just keep going. That is the one muscle. Everything else, all the other muscles fatigue. The heart doesn't fatigue. But if we put enough stress on it, it will fatigue. it will all of a sudden get thicker and unable to pump as well. And the goal of the heart is to pump oxygen through the body and to bring the carbon dioxide back. So if it's not doing that, that's what's going to hit us. The vessels that feed the heart also get obstructed or blocked or whatever when we put a lot of stress on those vessels. Hence, you get the heart attack. Kidneys, the same thing. Sexual dysfunction, erectile dysfunction, that's, it's another vessel. And if your blood vessels are not working in that area, then hence you can figure out what's going to happen. So these are things that just what we can talk about. I'm going to keep throwing out as we talk, racial health disparities, because that's something that we're going to have to come to at another point. We look at all the medications presently. I take 2 medications to control my heart, my blood pressure. Some people only need 1. Some people, may need, most people need either 1 or 2 medications. The problem is with this is that you see the top one, the water pill, the water pill doesn't work that well with people of color. So when we go to our doctors, if they don't understand that there's a difference in how these medications work on us, they'll be throwing diuretics or water pills at us, and it's not going to help us. So just as a point of information, the third one down is actually the best thing for people of color. Right, and those are things that, and we'll come back to racial disparities, because if your doctor don't know how to treat you because they don't know, and then you're not getting adequate care, and that doesn't help you. So I just wanted to throw that out. You guys know this already, the activity, the healthy eating. One of the things that I shared, a few years back is the what they call the Mediterranean diet with Pastor. And we were talking about how do we get healthy, how do we eat better, and that's something that we should look at. And and you see they talk about the DASH eating plan. That's basically just a Mediterranean diet, and that's something that we can kind of touch base on. Reduce salt. They don't say cut it out completely, but you should reduce your salt. And you can switch salt with spices, and your food will taste just as well. We are so primed that even my kids used to get. I mean, I'll use myself as an example. They put the food in front of us, and the first thing I do is reach for the. It's like, Dad, what you doing? Right? Taste it first. I was like, I know what it's going, but so I'll be honest with you. I'm a work in progress too. Limit alcohol and the medications. I have family members. It's like, yeah, you take the medicine. No, I took it when I got a headache. Well, when you got a headache, that's when you're getting close to a stroke. Then it's too late. The whole idea of this is prevention. So you don't want to get the symptom and then treat it. We're talking prevention here. So I just wanted to touch base. You guys know about this. We can head into that. I just wanted to throw this out, and you guys can Google it. 21st Century Cures Act. Right. This was legislation that was passed in 2016. And it's actually it only went into effect March 20th. And if you read it, it becomes very cumbersome. They talk about, with this 21st, with the act, the streamlining and getting drugs and technology, medical technology and medical drugs approved, like the warp speed thing with the vaccine. And they've actually allocated monies into that. That's not what I'm talking to you guys about. Part of the 21st Century Cures Act is also something that empowers all of us as patients, because now hospitals, doctors, if they're on using their medical records, if you got a smartphone and you're, I know NYU some uses what they call smart, what do you call it? Not smart chat, the app that you can schedule all your,
Snapchat.
oh,
Snapchat.
Snapchat, something. Yeah, I'll get the name for you.
No,
But
no, actually, New York Langone has an app that
yeah,
you can
that's the
talk to your
one.
doctor back and forth.
That's the one. And so now what is happening is, I'll tell you the name, My Chart. It's called My Chart. And all the hospitals have this. Now the legislation says the hospitals, the doctors have to make everything accessible to you immediately. Their notes, their labs, your x-rays, everything. They don't need to screen it and then send it to you. You have access to it. This empowers you, because this allows you to see what they're writing, what your diagnoses are. A lot of times we're asking people, doc, I got this problem. What's your diagnosis? I don't know. I got cancer. What kind of cancer? Exactly what it is. So your documentation, all that now becomes, as of March, that information. So it puts the onus not just on you. It puts the onus on you, because you now know what your health diagnosis are, what medications, everything that you need to know. If there's any question on a lab that you get back, right? You don't have to wait for the doctor to tell you your result. You can actually contact your doctor. What does this mean? What does this mean on my chest x-ray? Shouldn't I be doing something? So it empowers you to be a part of your healthcare instead of being subject to the hospital and the physician. So this is good. This is good. So I'm going to throw that out. There's more to come with the 21st Century Cures Act. So that's
Hey,
why I
Doc,
wanted
before you go on, let me throw a couple of questions people put in the chat at you really quick.
Sure. I'm sorry. Go ahead.
No, are there any natural ways to bring the third option after the water pill down? Being that it affects us as Black men the most.
When you say bring the third option,
I think of the list of options, you had the different, I guess, the pills that were
right,
the medications that were listed.
right,
And he said, and you mentioned that there's one that's really good for Black people. He said,
right. The third one, yeah, the angiotensin converting enzyme inhibitor. Yes.
Right. I'm just reading the question. Hey, Pastor Don, why don't you come on and just ask your question, man?
When you said bring it down, you mean decrease the dose?
Well, when you had mentioned what you mentioned, I said, that's the first thing I want to know. If it affects Black men the most, I want to know about what I have to do. Am I getting rid of this angiotensin, or am I feeding it, or, what do I have to do to make it better?
No, that's just the name. The angiotensin converting enzyme inhibitor. It's a name. It's a name of angiotensin is one of the things that is actually produced in your kidney that causes what we call vasoconstriction, right? Which vasoconstriction is when the vessels constrict, right? Which gives, if your vessels are constricted, right, it's more work for your heart to push the blood through. Whereas if you dilate the vessels, right, then it's easier for the heart to push the blood vessels to the blood through to get to the organs that it may. So it's just describing what it is. I think one of the things that I wanted to throw out, and which is kind of an addition to this, let's say you did have high blood pressure. Let's say they put you on medication. Is there a possibility of coming off the medication or decreasing your medication? And the answer is yes. And you do that by doing the other things, the weight, the diet, the exercise, all those things. If you do that, you could potentially decrease or even stop. My dad did. And he actually came off of medication because he was rigid with his diet and everything like that, to the point where they stopped him. They stopped his medicine. So it is possible to stop things and improve it instead of just halting it at one thing. if we're willing to put the work in. And that's
Wow, thank you. Let's get that work done.
yeah. Any other questions?
Nope, you can go ahead.
All
Thank you.
right. So I talked about the 21st, and I just, you know, I'm not going to give a full dissertation on coronavirus. I mean, one of the most frustrating things for us as physicians and people as patients going through this up to this day, the policies, the protocols kept changing. You should see us in the hospital. It was like 1 week we're doing one thing. Next week we're using the mask. Next week we're using a mask and a face shield. Next week we're using gloves, mask, face shield. Next week, no, take away the gloves. Next week do this. Next week, and it's because it's all a learning process, and we're going through this thing, and we're just trying to do the best with what information we have. So I'm just going to tell you what we're up to now. I mean, you know, as obviously you've heard, I can't and I cannot address any conspiracy theories. This whole Corona thing has become so politicized. I'm not getting into politics. I'm just going to tell you where we're at right now. Presently in the hospital, we're still using masks in the hospital because of who we are, where we are. But obviously you guys heard, you know, the whole concept of if you're fully vaccinated, all of a sudden now we're becoming to be a little free. And I think that's a good thing. It's such a, you know, if you're fully vaccinated, a lot of things you can assume not responsibility, but assume kind of a normal activity. The whole concept behind that is that as we're getting information, right? We look at people who are vaccinated, because look at the Yankees, right? We heard about the Yankees, right? And somebody else. They got the vaccine, but still they still became positive. The whole goal behind the vaccination, right, is the number one is to prevent you from dying. Number two is to keep you out the intensive care unit. Number three, yeah, hopefully you won't get it again. But the first two priorities, the death and the intensive care unit, those are the big two. So if we can do that, and there's no vaccine that is 100%, we know that. So what we did find is that the people who were vaccinated, whether it's with Johnson & Johnson, Pfizer, or the other one, AstraZeneca, or whatever it is, right, they're not dying. Two, if they do get it, they're not going to the hospital. Majority of them are asymptomatic. Why they actually now pull back the mask is that they're saying we were concerned because, okay, you got the vaccine, so you're not going to die, you're not going to go into the intensive care unit, but if you're still going to get it, can you spread it? And that is the new information. What they're seeing is those, if you had the vaccine, you're not spreading it. Hence, that's why the mask is coming off. You know, and everybody has to get to their comfort level. Everyone has to get to their comfort level. I'm still wearing a mask when I'm you know, even though they said to take it out on, you know, I just, you know, so I'm still wearing a mask, but at least I feel better that based on this, based on the information, you know, one, I'm not going to die from this. I mean, something else may do it, but you know, my chances are better. So I am not, one point I want to make is I am not here to convince anybody to get vaccinated. You have to, and I tell everyone, you have to look at your personal risk, your comorbidity. What is your comorbidities? Depending on your comorbidities, you have to put yourself in that risk. And you know, your age, do you have high blood pressure? Do you have diabetes? Do you have some type of immune disease? If you have these things, your risk is higher. So
Doc, when you were explaining those symptoms, that is comorbidities you're referring to, right?
Correct. Comorbidities is, you know, high blood pressure, diabetes, some immune deficiency. You got cancer, you're on immunosuppressive drugs. You know, HIV is an immune deficiency. Anything, you know, those things that may now exacerbate. Do you have any pulmonary disease? You got, you know, asthma. Do you have, what's the other one? Sarcoid, you know, those things. Those are all comorbidities that you have to look at. You have to look at your age. You know, the older we get, the less, you know, we don't bounce back that quickly. You know, those are all the things that we have to take our personal and look at it. And and like I said, I will not tell anybody. I would just say, this is the information, you take it and you run with it. So that's, any other questions? This tends to open up a lot of questions on the.
Yeah, you know, it's really good information. You know, there's so many like you said, conspiracy theories and all this other stuff that, you know, you're trying to counter. And we're careful, you know, is according to everyone's comfort level, I guess, in terms of whether they get it or not. But I like the fact that we understand what the current state is.
Correct.
You know, for people who are vaccinated, what the scientists have found, what the hospitals have seen in terms of people actually having to go. Because you see people who, even though they've gotten a vaccine, you know, they may get COVID again.
Yeah.
But as you mentioned, they're not dying. They're not necessarily going to the hospital. And a lot of times they're asymptomatic. But for the people who are not vaccinated, you know, the risk is still out there.
Yeah.
You know.
Yeah. And it's a personal decision, you know, and one of, you know, I'm going to address a little bit at the end with the rate. I'm not going to go too much with the racial, but we do have a reason, especially African Americans, to be hesitant for the vaccine.
Yep.
But we also have to be careful, and I make this point, that we can't be stuck in the past. We know what happened in the past. We know what happened. We know what they did in the past, but we have to, you know, we have to look at what's going on currently, and you know, so that's one of the things. So we kind of hit everything like this: what you can do, what you can't do, and stuff like that. And this is kind of a graph. You know, I like the one on the right. It's I don't want to make anybody jealous, but I feel I like the one on the right. Yeah, I like the, you know, and even if I'm on the right, I have the ability. If I want to put a mask on, I'll put a mask on if I wanted to. But on the one on the left is a different story. One of the concerns with this now, as we're going through this change, is that things are on a trust level now. You take the mask off, things are on a trust level. You walk out to the street, I don't know who's who, you know, what's you know, you just don't have a mask on. You know, so it's a trust level that, you know, that when now with this new not mandate, but they say that you can remove the mask. Now I trust the people who say that they're not wearing a mask, that they're vaccinated. Can we? I'll just leave that.
Yeah.
So that's one thing. So any other questions about the corona? Anything?
I think just for the sake of time, Dr. Dunn, you know, we'll table the questions when you come back. You know, we will definitely get more into that. Mm-hmm. So we'll let you carry on.
So Doc, I would agree. I would agree with Rodney, because this is a topic that, you know, we could talk all night about.
Yeah. So this is going to be short. I mean, because this is a big topic, but this whole
and actually, Dr. Don, I'm going to need you for this topic on a separate matter. So we'll talk offline about this topic. Yeah.
The whole concept of health disparity, we can talk about, you know, what was done in the past. Everyone talks about the Tuskegee. Tuskegee was just one small part of the history of the disparity. What was done to the American Indians, what was done to the women, slave women. They were experimented on by gynecologists, and usually hear the studies and that what was done to women. Presently, we're still dealing with health disparities, and we need to talk about that, even down to the tests that we do. If you got asthma and you got an incentive spirometry, that test is racially biased based on how they interpret it. If your kidney function is racially biased, and that's going those things are going all the way back to slavery, how they interpret your kidney function, GFR. Right now, even in obstetrics and gynecology, how do we counsel women for C-section with, should they have a trial of labor after having a C-section or not? There's racial disparity in that. So there's a whole lot of work that the medical team has to do. And there's a lot of ignorance in medicine, in the medical society, you might say, down to the point where in February, they had one of the editors or junior editors saying there is no racial disparity, there's no racism in medicine. So there's a lot of education involved, from a health perspective, but just racial disparities, where we live, our zip codes, everything that we need to discuss. Who do we elect is going to come down to the most. So I just want to end with that as an introduction, and then Brother Rod, we can focus down on things that you want me to do. I really appreciate. Thank you for giving me the opportunity.
You are so welcome. And listen, you will be back very soon, because I think there are quite a few of these areas, including this last one. This is a big issue that we need to really dive into and understand a little bit more about it. And the fact that it has to do with health, which you would like to think doctors are neutral, but how can they be neutral? We're all people, right? So just by the fact that we're people, and we get racist people, you got other kinds of people, you got people just conditioned a certain way,
That's right.
And even when you spoke about, understanding the nature of Black people,
correct,
what medications actually help us and which medications, don't necessarily help us. It's important. Guys, I want you to know this video will be made available. We're going to have it on our YouTube. It's part of our series at ICB Men. So you can access it. It'll be up in a couple of days and you can watch it again. But we are going to have Dr. Matheson back to zero in. And, you'll hopefully be a regular visitor here, discussing these issues, because, we, especially men, we have a lot of issues, but I think what's great is information sort of uncovers the mystery about these issues. And in this forum, it gives us an opportunity to ask the questions and to just put it out there. And once it's out there, then you can deal with it and you can address it. So I just want to say thank you so much. And DJ Don O'Mel, if you can just stop sharing. We can see the guys. Guys, you can please show your love to Dr. Matheson.
Thank you, and I love you. I miss you guys. I love you. Thank you.
Thank you.
Really great seeing you.
Thank you. Thank you.
I know the guys are about to go into their breakout rooms, their regular breakout rooms. I'm going to stay here in the main room for a minute with you, Dr. Matt. Don, O'Mel, you can send, the guys to their regular groups. And Simon, we're having the pledge ceremony for our brother Kadeem and brother Jeff Smith. And there's a request to have a couple of people present.
Ooh, okay. Let me change this around.
Terrell and brother Raymond Bradley, if they're available to be a part of the event, that would be great. They would be honored.
I can't come. I don't have a tie on.
That's right. We're not letting you in anyway, but like they say, relationships precedes resources. So because I know you, I might just let you in.
I'm gonna reach over and grab a tie real quick.
All right. Well,
you just need your cane, Brother Simon.
You got a little time. So there we go. Dr. Don, I got to say thank you so much again. This is really a discussion. There's several discussions within a discussion here that we're going to tie into. We look forward to seeing you next time. You're more than welcome to sign off, or you're more than welcome to join the ceremony. It's up to you. But we truly appreciate you.